You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. On today's topic, we will be discussing what endometriosis is. I know endometriosis affects a lot of women, and still a lot of women still don't know what this is. So this topic is for educative purposes and also to let women that are affected with endometriosis to know how to go about solving the issue. What is endometriosis? Let me just explain it, okay, so that you can all understand. During your menstrual cycle, the lining of your uterus called endometrium begins to thicken in preparation that you might get pregnant, okay? So if you don't get pregnant that month, your body sheds the endometrium during menstruation, and the process will start all over again right after you bleed. In the case of endometriosis, tissues that are very similar to the endometrium begins to grow outside the uterus in various places that it shouldn't, okay? It can appear in the ovaries, it can appear in the fallopian tubes, you can see them in the lining of the pelvic cavity, you can see them in the uterus. Sometimes it is even found in places like the cervix, vagina, rectum, bladder, So you just see this tissue everywhere. The problem is that this tissue behaves like the normal endometrial tissue. It builds up and it breaks down with your menstrual cycle, but it can't be shed like the normal menstrual period. So as a result of this stubborn tissue causes irritation and inflammation. Then the buildup of tissue can prevent the eggs from getting to the ovaries or being fertilized by the sperm. It can also cause you to have scars and blocked fallopian tubes. It can also prevent the eggs and the sperm from meeting each other. So this is a very serious issue, okay? How do you know if you have endometriosis? With endometriosis, you see symptoms such as pelvic pain, painful intercourse, painful urination, painful bowel movements, severe abdominal pain, you have lower back pain, you have heavy period or spotting in between your period, you get tired easily, all these are symptoms that a lot of women that are affected with endometriosis would notice. And in some cases, there is no symptoms at all. So this means that it will be diagnosed at the hospital, probably through a scan and through an ultrasound. How is getting pregnant like during endometriosis? When you have endometriosis, truly it's difficult getting pregnant, but also, it can be managed in some cases, okay? Most women who have endometriosis can conceive also, because it just varies. It depends on where these tissues are. But if you have problem getting pregnant, endometriosis may also be the cause, okay? So to find out, that means you need to go to your doctor. He might probably do laparoscopy for you. And in this procedure, what happens is that there's going to be a cut, and a small camera will pass through a tube into your abdomen to check your abdominal tissue, okay? Your doctor might also want to confirm, okay, with a biopsy, so probably take some sample, okay, during the process. If you have been diagnosed with endometriosis, or you have several treatment options depending on the severity of the diseases. Medication, either alone or in combination with surgery, can also help, okay, in management of your endometriosis. If you and your doctor are opting for surgery, then you might attempt to remove some tissues and to help you to improve your chances of getting pregnant. So you should know that getting pregnant also, is very difficult with women that has severe endometriosis, because some women with endometriosis has problem with their ovulation, And although another treatment option is to use clomid to induce ovulation. Okay, once you begin to now successfully ovulate, yes, your doctor might suggest trying IUI or IVF so that the tissue doesn't grow back. Okay, so it is very, very important for you to let your doctor knows that you're trying to get pregnant if you have endometriosis, because some other management drug might just throw you into menopause. So you just need to let him know that you have endometriosis. You also want to have babies, so that it doesn't start you on management option that won't be beneficial to you at the end of the day. Okay, so that's all for endometriosis today. I hope you've learned something. Thank you for watching today's episode of Fertility Talk with Olarunke Thaddeus. For more enquiries, you can comment below, and for consultation, you can send us a DM. Please don't forget to subscribe to our YouTube channel and share this video. And we are also available for sponsorship. Thank you.